axillary tail of the breast, although it seems a very rare entity, you'll be surprised that it's a very common clinical condition which we as plastic surgeons encounter. And if you look at the incidence of this condition, 6% of our women have this condition. The commonest swelling in the breast is an accessory breast tissue. Now there are also some uncommon conditions which involve the axilla. This could be in the form of enlarged lymph node. It could be a swelling of the fat tissue. It's called a lipoma. That could also be mimicking axillary breast. And there are also various other conditions like vascular malformations and other entities which could mimic axillary breast. But majority of our women in the younger age group, they suffer or they may have axillary breast in their axilla. Majority of patients who seek treatment for the axillary breast is because they have symptoms. Now, what are these symptoms which they commonly come to us with? It could be a discomfort. Now, the discomfort could be because of malodor coming out from the axilla, because there are a lot of sebaceous glands in the axilla which could cause this problem. And they could also have excessive sweating, which could be an issue with swellings in the armpit. At times, these women, they also have difficulty in moving their in maintaining their arm positions because of the swelling in the armpits. They have a problem of actually trying to cover the swelling, so they constantly hold their arms towards their bodies, or it's sometimes painful that they always keep their arms away from the body, and they maintain very loose outfits to camouflage the swelling. So they are either holding their arms closer to their bodies, or they are holding their arms away from the bodies, and making them very discomforted in maintaining these positions. And it's not easy to keep the arms always towards the body or away from the body. Another common symptom which our patients have is pain in their armpits because of the swelling. Now, you know, the swelling is nothing but accessory breast tissue. Now, because of the breast tissue, there is cyclical pain which actually happens because of the hormonal variations. So, majority of the patients who have swelling in their armpits, they seek treatment because of symptoms, because of discomforts, and cosmetic is actually their probably their last priority. Although it's an important priority for them, they seek it last. Now, some of the patients who do come to us for cosmetic reasons, they're not able to wear the clothes of their choice, and thereby they seek treatments for the swelling in their armpits. So, what do we do for these patients who have axillary breast? First of all, we do an ultrasound. We image the breast. We see what the swelling is. We try to rule out the other swellings which are commonly seen in the armpits. And once we know that this is not a pathological condition where there is a lymph node or a lipoma or a sebaceous cyst, so we know that we are pretty sure that it's an axillary breast in the axilla, and the treatment for this is purely surgical. It cannot be medically managed. Now, the surgical options for an axillary tail of Spence or an axillary breast tissue, it varies depending on the size and depends on the content of the breast. Now, we get an ultrasound done. The ultrasound gives us an idea whether this has excess fat or whether there is a lot of dense breast tissue. Now, if there is more of dense breast tissue, we have to remove it physically through surgery. That's an excisional surgery, where we remove it through a surgery and get rid of the swelling. Now, there are conditions where there is a combination of fat and there is also a combination of glandular tissue. So, in these conditions, we will have to combine the surgeries, where we will have to do a liposuction to remove the breast tissue, and also remove the accessory breast tissue through an open surgery, and thereby preventing a recurrence. There are also patients who come to us with very enlarged swellings, and these patients, if they were to get a surgery, would have to undergo an extensive incision. So this is not something which we want for our patients. So we do all these surgeries through a short scar surgery in the axilla, and through the incision we remove the gland, we do the liposuction, and through the short scar technique we also manage the excess skin. We can do this to a certain extent, but if the skin excess is so large, so excessive, we'll have to resort to something called as radiofrequency assisted liposuction, where we pass the radiofrequency energy under the skin, which causes significant contraction. So what this actually does is it reduces the skin stretching. It also decreases the chances of doing a second surgery, which most of these patients, if not given the radiofrequency energy, will have to go for a corrective surgery later on. So what the radiofrequency does is actually to eliminate the second stage of surgical correction. It causes a fantastic skin shrinkage, and through a short scar we eliminate the excessive breast tissue. Most of these patients are managed as a daycare procedure, and we do the surgery. The surgery lasts for 1 to 1.5 hours on both the sides, and on the same day they are discharged. After doing the surgery for the accessory breast, compression is a very important entity which helps in maintaining the result. Now, there are not too many good compression garments or devices which are there available in the market, but we at our unit at Star, we have evolved a dressing which helps in giving adequate compression with little or very minimal discomfort. The compression dressing will have to be worn by the patient for almost up to 3 weeks, till such time the skin shrinkage happens, and till such time the swelling in the armpit reduces. So it's for 3 weeks we ask them to wear these dressings. Ointments are given to dry up the suture line and to prevent any infection, and generally by around the 10th day they are very comfortable. They can go for their routine activities. By the end of a month they would be able to go and do their routine physical activities or gymming activities or other outdoor activities. When we get women with swellings in their armpits, some of them actually are apprehensive of the fact that these lumps can be cancerous, they could grow and it could be dangerous. But it's not so. I mean, most of these swellings are very benign. It's just nothing but growth of their breast tissue and little bit of fat, which actually causes the swelling. So these are not malignant, they are not cancerous, and we try to reassure these patients that everything is going to be fine, and surgery is 100% curative for these swellings.